Good morning. No. Good morning. Good morning, Good morning, everybody. It is fantastic. I have just checked that you haven't all been together without me, and I discover that I wasn't left out of a big meeting in another place. So, as far as I'm aware, this is probably the first time we've all been together in a room since the Building a Healthier Gwent conference in November 2019. And the Director of Public Health has invited you, so it's got to be okay, hasn't it? So with no further ado, I'm going to hand over to Councillor Sean Morgan.
Good morning, everybody. And welcome here to the Lysaght Institute. Just a few things on housekeeping. First of all, there's no fire alarm test today, so if it does sound, please make your way to the nearest exits, either side here. And the fire assembly point in the main car park. Please take a moment to familiarise yourself with these locations. Smoking or vaping are not permitted in the building. Hopefully, given our topic today, we don't have too many smokers here. But there are designated smoking points outside the building and on the balcony. Bathrooms are on the ground floor and on the first floor, and Wi-Fi is available throughout the building. If you have any difficulty connecting, please contact a member of the staff. So I'm Councillor Morgan. I'm very happy to welcome you here to the launch of the Gwent as a Marmot region. I'm delighted to have been asked to welcome you all to today's events, to introduce the prestigious list of speakers that we have lined up. And before we start, I would like to say a big thank you to all the hard work of the Aneurin Bevan University Health Board team, together with other colleagues in the public sector in Gwent who've got us to this point. Having only recently joined the Gwent Public Services Board and recently been appointed as the chair, this is my first opportunity to get to meet a number of you in person and get to grips with what is required in this role. First of all, I'd like to say something about the splendid surroundings here. The history of the Lysaght is very fitting to today's aims. I'm forgetting to do the click. W.R. Lysaght developed the Orb Steelworks in Newport, the company's third in Britain at the time. He wanted to improve the welfare of his workers, so his company and its staff built the Lysaght Institute. It was financed jointly by the company and its workers. It stood in 8 acres of ground near the works entrance and provided a range of facilities for staff, including a ballroom, courts, bowling green and ornamental gardens for recreation and relaxation. It was a social movement. He also campaigned for the construction of the Transporter Bridge, which I'm sure you've all seen on your way here today, so that workers would not have to walk over an hour along the banks of the river and back to get to work. It had only the second sprung dance floor in Europe as well, so people came from all over the world to come to this room. We're all aware that there are great disparities in how long people live and how long people live in good health in Gwent. The gaps are due to inequity, the unfair differences in the conditions starting at birth and continuing through people's lives where they live and work. Today is about how working together we can achieve goals. This is especially important given the issues that we are facing at the moment. It's barely a year ago since senior public and third sector leaders and politicians came together as a new regional PSB covering the whole of Gwent. The benefits of merging the former 5 local authority area PSBs are obvious. It provides a high-level, wider area view of the well-being of a larger population. There are greater synergies in ideas and best practice across the region, and of course, it makes more sense collaborating with coterminous regional partners and Iron Bevan University Health Board, Gwent Police, the Police and Crime Commissioner, and our wider region partners, South Wales Fire and Rescue, Natural Resources Wales, the University of South Wales, etc. Other important members of the PSB cover the voluntary, housing and education sectors. There is a long history of strong public sector partnership in the Gwent area. The 5 separate PSBs in Gwent have already collaborated on a number of regional projects. For example, the provision of electric vehicle charging points in public car parks and a review of the sustainability of public sector fleet. Merging has provided a more simplified and streamlined model and closer alignment with other existing regional boards, such as the Regional Partnership Board and Safeguarding Boards. And it is providing greater opportunities to pool ideas and resources to look at landscape-sized problems, such as the climate and nature emergencies, and develop collaborative solutions to issues affecting the well-being of the whole population. Public service boards improve joint working across all public and third sector services in each local authority area in Wales. They must work collaboratively to improve the economic, social, environmental and cultural well-being of their region and contribute to the achievement of the 7 well-being goals as set out in the Wellbeing of Future Generations Act. Each board must carry out a well-being assessment and publish a well-being plan. The plan sets out how they will meet their responsibility under the Act. We know that life outcomes at birth are very much worse in our most deprived communities. So the focus is on generational change by working on the problems now, but with an eye on preventing problems in the future. The wellbeing assessment for Gwent, completed earlier this year, highlighted the inequality and deprivation in our communities and the need to take action on how the climate and nature emergencies are having an impact on well-being. We know that the environment we live in, our health and cohesiveness of the communities that surround us are key to tackling inequality. Using the evidence from the assessment to tackle the social, economic, environmental and cultural issues in Gwent, the Public Service Board has drafted its first wellbeing plan for the region. As with the assessment, we're using the 5 ways of working: collaboration, integration, involvement, long-term and prevention to guide our work. Since that assessment, we've had to take into account other significant problems. The war in Ukraine and the cost of living crisis have made some people's lives so much harder. We've identified 3 draft objectives. We want to create a fair and equitable Gwent for all. We want to create a Gwent that has friendly, safe and confident communities. We want to create a Gwent where the natural environment is protected and enhanced. As we continue to develop the plan in consultation with the public and our partners, we will focus on how we can all work together more effectively. At the first meeting of the Gwent Public Services Board last October, the board considered a paper on a healthier Gwent from the Director of Public Health for the region to look at agreeing some short, medium and long-term objectives to reduce health inequalities across Gwent, and by doing so, to work together to be an effective catalyst for transformational change in the region. By the next meeting in December, the PSB considered a proposal from the Iron Bevan University Health Board that the region considers becoming the first Marmot region in Wales. And the PSB unanimously agreed that the proposals should be explored further so that the Marmot principles as a realistic, truthful and optimistic programme could be used to form the framework for action to reduce health inequalities across Gwent. And so it was agreed to formally open discussions with the University College London Institute of Health Equity about the potential benefits of working with them on Gwent becoming a Marmot region. Following a great amount of work led by our own PSB member, Dr. Sarah Aitken, PSB members have confirmed their commitment to make a real difference and refocus and accelerate progress towards reducing the root causes of health and related inequalities across Gwent. This will be done by addressing the social conditions that drive and sustain inequity in our communities: education, income, homes, transport, food, communities and the environment. The response will now be framed through the 8 Marmot principles alongside the wellbeing objectives and steps to help in the delivery of the wellbeing plan. But rather than steal any of my colleagues' thunder, I will leave it to them to explain what those principles are later. We will be using Mentimeter throughout the day. Mentimeter is an online interactive voting tool, and we will use it to gauge audience knowledge about inequalities and how they affect the long-term outcome for individuals. Mentimeter is available on the website on this slide here. If you were able to access it on your smartphones, we would be grateful if you could vote using the code, which is also on the screen here, to access the survey. We will run the same questions at the end of the event to see if the presentations have helped improve these scores and improve understanding. During the break this morning, we will also use it to gather your views on suggested branding for the Marmot region. This morning's event is offering a valuable opportunity for senior leaders across Gwent to get together, share knowledge and ideas, and start to make plans for addressing inequities over the next 5 years. We have the unique opportunity of welcoming Sir Michael Marmot to the region to hear him speak about the inequalities and the 8 Marmot principles, and discuss with us here today at the Lysaght Institute and to those of us joining online about how we might work together to address these inequities in our region. We want this event to represent the Gwent Marmot Region's programme's aim of being truthful, realistic, but optimistic. We will be hearing from local public health and local authority leaders about inequities in Gwent and what can be done to address these. We will also be joined by Newport Live, who will be talking about their brilliant project, Positive Futures, for children and young people. And after a refreshment break, local leaders will be joining Sir Michael on a Q&A panel to offer the audience the chance to ask important questions about these inequities and about the programme. Thank you.
So when we were organising it, we thought it would be helpful if I just give a very brief summary of why we decided to become a Marmot region. And the starting point is that we have a 20-year gap in the years that women live in good health across our community. In our most deprived areas, women live to 48 in good health, and in our least deprived areas, they live to 69 in good health. That is huge impact on those individuals and their families, but it's actually a huge impact on wider society. When you think that the people in our most deprived areas are the most likely to be in manual work, and therefore, if they are least likely to be in good health in their middle years, that is of importance for the economy as well as wider society. The gap for men is 13 years, with men in our most deprived areas living to 53 on average in good health and 66 on average in good health. And I'll leave it to Sir Michael to explain why that is, because that's not unique to us. But the reason why we are becoming a Marmot region is that the problems that exist elsewhere have existed here intractably for many generations. And the reason in the past was in many ways associated with occupation. And I'll come on to the annual report I published, but that was about the ambition that while in the past there may have been things that were beyond people's control, now this is about enabling people to live healthier lives, and it can be done. And I hope by the end of the morning you all are convinced it can be different for future generations, and that we all go away to make it happen. Yeah. I've got 2 buttons to press. So why? What are the 2 big killers are heart disease and cancer. They always have been. And what this map shows is that in our most deprived areas, which are the darkest areas, a greater proportion of people die under the age of 75 from heart disease. Now, in 2022, it is a reasonable ambition to get past 75 alive. And that is not happening for many of our population. And the same is true for cancer. You see exactly the same picture. And when you look at the map of deprivation for our area, you can see it's exactly the same. And as a public health professional, I could show you many maps of health outcomes, starting with low birth weight, childhood obesity, and they would all reflect that pattern of deprivation. And the index of multiple deprivation is made up of a number of individual measures, and the biggest being income and employment, and those are combined to give the score. And that is today's message, because it's about those wider inequalities. Everybody in our area has access to the same healthcare. There's one University Health Board area. My colleague, Dr. Will King, did a PhD to look at the question about whether the inequalities in premature mortality from heart disease could be attributed to access to healthcare. And he found that there was absolutely no difference. That was one graph that showed no difference between our most deprived and least deprived areas. This is about the reason people get heart disease in the first place. It's not about healthcare. So back in 2019, I published my annual report, Building a Healthier Gwent, and I deliberately framed it as an ambition that things could be different. And I have said a personal thank you to those in the room who got behind me at the time. And we had a conference in November 2019, and as I said earlier, that's probably the last time we all came together. And at the time we had the leadership group G10, which is now evolved into the Gwent Public Service Board, and the leaders on the Public Service Board, I just would like to thank you all for understanding the case for change, for committing to the case for change, and for why we are here today. So this comes from the original review that Sir Michael published for England, and there's some really important principles in here that I know he'll talk about later. But the key message is that babies are born with disadvantage before they've even started their life, and that disadvantage accumulates over the life course. And there are moments to intervene across that life course, with the most effective being at the start of life. And Councillor Morgan talked about educational attainment, and you will see the same pattern. That's what came out of the wellbeing assessment. The wellbeing assessment was that everything we looked at across Gwent had exactly the same pattern of inequality. So this is educational attainment. which is the prerequisite to a well-paid job, which you see the same, the educational attainment translates into the employment. And this is a diagram that Public Health Wales produced recently about the impact of cost of living, and I'm not expecting you to read it. The take-home message is it's a very complex system, and multiple things all come together to increase the cost of living, and that's true of all sorts of things. It's a very complex system, which is why we need a whole system approach. And one organisation cannot do this on their own. We all have to have a whole system approach. And as has already been said, that is getting more difficult. So this is a recent ONS survey asking people about whether they were cutting back on what they're spending money on, and the really sobering one is in the middle there, spending less on food and essentials, 40%. So the problem I described in 2019 has been made worse by the pandemic and is now being made worse again by the cost of living. So this problem is getting worse. And if we keep doing more of the same, we'll get the same. And I know colleagues will talk about this later, but if we just do a small bit of change on the edge, we're not going to change this. We need to do something transformational. And the reason we're being a Marmot region is because the Institute of Health Equity are the international experts on this. We don't need to go away and find out what works. They're the people who know what works. Our job is to implement it. And I just do fundamentally believe that there's no reason why it can't be different for future generations. The principle behind the Act is the right principle, and I would like to suggest that for the people in this room, it is our job to make it happen. So on that note, I'd like to invite Professor Sir Michael Marmot to speak. It's been a long-time ambition of mine for you all to hear him speak, because every time I do, I go away and decide to try harder.
Thank you. You don't know this, but you are, at the moment, conducting psychotherapy for a colleague of mine. I'm getting these anguished messages from a colleague saying, the world's all awful and everything's going to hell and no one's listening to me, and oh my God, I'm so depressed. How do you keep going? And I wrote back to her and said, I'm sitting in a hall in Newport, listening to a counsellor explain that they are part of a social movement, and the way that will take tangible form is to make Gwent a Marmot region. We never imagined, I said to my colleague when we started on this journey, that our ideas would have such reach. And she came back to me, she's already feeling better. So I'm really grateful to you colleagues for helping my colleague out of a tight hole. I'm going to give the... Oh, that too, yeah. They told me I had to do two things at once, which is a bit of a challenge to my cognition, but there we go. I'm going to give the general context of what we've been doing. And there are two messages. One, the one that I got from my colleague, it couldn't be more awful, could it? I mean, what's going on nationally couldn't be more awful. But the second message is there's a great deal that we can do at regional level, at city level, at local level, even at national level. I mean, Wales is pretty much the same population as Greater Manchester, And we've been working, as I'll say before I finish, with the Greater Manchester region. And my feeling about Wales is if it can't happen in Wales, it can't happen anywhere. Because so much of the general context is favourable. Yeah, but this isn't it. Okay. The opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. Exactly as you say, at a time where the NHS is being pushed, shuddering towards the edge of a cliff. We think a great deal about the healthcare system, as we should. But the real determinants of health inequalities lie outside the healthcare system. It's hard to keep up, isn't it? I talk about 3 recent challenges to health inequalities. Forgive this bit of indulgence. I was asked by the BMJ to write a commentary on the apparent lack of appearance of a health disparities white paper. And I said in my commentary that it's not just the lack of appearance of a health disparities white paper, it's what the government is likely to be doing that will damage health inequalities. And I sent it to the BMJ last Friday, almost before the ink was dry, figuratively. Policies had changed. The Chancellor had been sacked. Jeremy Hunt comes in on Monday, the great saviour of the NHS, the man that everybody in the NHS loves because of the way he preserved the NHS, absolute commitment, safe pair of hands. And he changed everything. He'd reversed. And so I wrote a foreword to my own piece, a paragraph saying things are changing with such dizzying speed that what I wrote on Friday is out of date. And the BMJ published it Monday evening online. And I then get a message from the BMJ this morning on the train saying, well, that's clearly already out of date. We'd like to get it in the print version with a new introduction. My God, I mean, anyway. So when I talk about 3 challenges to health inequalities, a decade of austerity, the COVID pandemic, and the cost of living crisis, we could now say the libertarian experiment was a major threat to health inequalities. And then that's number 4. And the reversal of the libertarian agenda to go back to austerity Mark II is number 5. And who knows what the outcome of the next week will be. I think what's the cat's name from Downing Street might well be Prime Minister. But so in 2010, we produced the Marmot Review, Fair Society, Healthy Lives. It fell into this swirling world of politics. It was commissioned by Gordon Brown as Prime Minister. It was utterly predictable that soon after we reported, there would be a change of government. Labour government was unpopular, and we got a coalition led by Conservatives. We had 6 domains of recommendations in the 2010 review. The first 6 were give every child the best start in life, education and lifelong learning. Number 3, employment and working conditions. Number 4, highly relevant to the moment, everyone should have at least the minimum income necessary for a healthy life. Number 5, healthy and sustainable places in which to live and work. And number 6, taking a social determinants approach to prevention. In of the COVID pandemic, we added number 7, tackle racism, discrimination, and their consequences. And 8 should have been there all the time anyway, that pursue the health equity and the climate agendas together. And it needs to be said, I was talking to a group devoted to dealing with the climate emergency, and they really had not thought about health equity. It just wasn't on their agenda. They didn't disagree with anything I told them. They just hadn't thought about it. And those of us concerned with health equity need to be thinking about the planet. Just before the pandemic crashed upon us, in February 2020, on the 10-year anniversary of the publication of the original Marmot Review, it was also my daughter's birthday, but that's not relevant, we published Health Equity in England, the Marmot Review 10 years on. Life expectancy had been improving about 1 year every 4 years. Started this in 1989. I could have started it in 1889. For a century, life expectancy had been improving about 1 year every 4 years. And then 2010, there was a break in the curve. Let me put it this way. If you were elected as the government in 2010 and you said, our ambition is to slow down this appalling improvement in health that's been disgrace of our nation for the last century, and we're going to do something about it. You could look back and say, no one else managed that, we did that. For some reason, they didn't quite say that. They said, well, maybe we've just reached peak life expectancy. You can't surely be alleging. So coming back to that chap who's the Chancellor, I wrote to Jeremy Hunt at the time that we published this. He was Secretary of State for Health, and said, you need to treat this with the same seriousness with which you would treat a winter bed crisis. And he did. He ignored them both. And then the pandemic came, and life expectancy dropped further, dramatically. Just think, life expectancy pre-2010 was improving at about the rate of 1 year every 4 years. We lost 4 years of improvement in 1 year with the pandemic. And most countries didn't do that. The US was worse than we were. But we were among the worst. We got the big decisions right. I've forgotten what they were, winning the World Cup or something. We got the big decisions right. No, we didn't. We managed the pandemic appallingly badly. And the idea that maybe we'd reach peak life expectancy, well, let's look at the evidence. We looked at other countries. The improvement in life expectancy in Estonia, Norway, Slovakia, Hungary, Denmark, all of these countries was more rapid than in the UK. There we are, right down at the bottom. The only countries that had a slower improvement during that decade were Iceland and the United States. No, we had not reached peak life expectancy. Something that was going wrong in the UK that was not happening in these other countries. And arguably, it related to austerity. And if we look at regional differences, what you see, look at the women. What you see, but it's similar for the two genders, what you see is if you're rich, it doesn't much matter where you live. in the country. If you're poor, the most deprived 10% down the bottom, it matters enormously where you live. The regional differences are much bigger. The gradient is steeper. Life expectancy was going up in London and going down in virtually every region outside London. So this is where we were pre-pandemic. Life expectancy had stopped improving. Health inequalities were increasing. And life expectancy for the poorest people was going down. And now we've got austerity 2.0 to look forward to. What? Where are we? Wales, yes. And one of the problems is that Wales was doing worse than the UK average. I'm on the Independent Constitutional Commission for Wales, and one of the issues that I raise, and firstly, the big question I raised is, what did you want me to serve? What do I know about constitutional arrangements? Well, the voice that I bring to the discussion is, what would deliver the best equity of health and well-being for the people of Wales? Is there a set of constitutional arrangements that would favour that? Because it doesn't look good. This is the inequalities between the most and least deprived. Life expectancy at birth for the least deprived and the most deprived. It's enormous and has been increasing. And arguably, Wales has the most progressive government in Europe. Why is this happening? Is it because the context is all being set in Westminster? Is it because Wales has been poorer than England for a very long time? It's not recent political history, but it's a very important challenge. And in healthy life expectancy, we've got the United Kingdom, England, Scotland, Wales. So if you agree with the general proposition that health is telling us something very important about the way society is organized and the degree to which it's meeting the needs of its members, something's going wrong. And the challenge is to put it right. And when we look within Gwent, big differences in life expectancy for different parts of Gwent. I'll come over this. So, what happened post-2010? The government that took charge, the Conservative-led coalition government, had as its number one priority austerity, getting the public finances in order, it said, rolling back the state. And by golly, they did it. In 2009-10, public sector expenditure was 42% of GDP. By the end of the decade, that went, that 42% of GDP, by the end of the decade, that 42% had become 36%. We were now more or less in line with taxation. You know, you've been hearing that taxation's at the highest level for 70 years. We are a very low tax country. In Finland, taxation is 52% of GDP. In France, it's 51.5%. In the Netherlands, in Denmark, in Germany, in Italy, the tax rates are much higher. 36% compared with 52%. Yes, the US is only 31%, but they've got worse health than we have. We are a very low tax country. And the question isn't, what else can we cut out of public services? The question is, do we want to pay for the Marmot 6 or the Marmot 8 recommendations? Do we want to pay for them and create a better society, a healthier society, one with narrower health inequalities? That's the debate we should be having. Do we want to be like the US when it comes to inequalities? Or do we want to be like the Netherlands, or Germany, or Italy, or France, or Finland, or Norway, or Denmark, or Sweden? In my 2010 report, we coined the rather awkward phrase, proportionate universalism. We said that we want universalist policies, like continental Europe, the Nordic countries, and we also want Anglo-Saxon policies where you target the worst off. Well, combining these, we said universalist policies with effort proportionate to need. You could call it levelling up. There's a thought. Oops. So, if we had deprivation, less deprivation along the x-axis, and let's say life expectancy on the y-axis, if you focus only on the worst off, you miss the gradient. So if you just think of these people, what about these? So universalist policies with effort proportionate to need. What did we get? 2010. This is spending by local government since 2010, the change in spending. In the least deprived 20% of areas, the reduction in spending was 16%. And then the greater the deprivation, the greater the reduction. In the most deprived 20%, the reduction in spending per person was 32%. What we've got here is effort inversely proportionate to need. The greater the deprivation, the greater the need, the greater the need, the greater the reduction in spending. Could this have played a role in the slowdown and improvement in life expectancy, the increase in inequalities, the declining life expectancy in the poorest areas? Yeah, I think it could. Unless you think that nothing that happens with local government expenditure makes any difference, and I don't, I think it's crucial, then this could well have played a role in the health picture we see. And you can see it in Welsh councils, the reduction in council expenditure. The second major challenge was the pandemic. We waited 10 years to do the Marmot Review 10 years on. We waited only 10 months to do the COVID-19 Marmot Review. And you remember at the beginning, it was said COVID will be the great equalizer. The prince and pauper alike will get COVID. Even that chap with a strange haircut, the Prime Minister, got COVID. But it was always obvious that it would expose the underlying inequalities in society and amplify them. Here's the social gradient, the dark green bars, all-cause mortality. Classify people by where they live, classify where they live by level of deprivation, and the greater the deprivation, the higher the all-cause mortality. And for COVID-19, it looks almost parallel. So it's slightly steeper, slightly bigger excess in the the three most deprived deciles, which we think is related to employment in frontline occupations and living in overcrowded households. But it means that the discussion about control of the virus, vaccination, social distancing are important, but they're only part of the story. We have to deal with the underlying inequalities, because if it's not COVID, it'll be dental caries. And if it's not dental caries, it'll be childhood obesity. And if it's not childhood obesity, it'll be cardiovascular disease and cancer that follow the social gradient. And I said expose and amplify the underlying inequalities in society. If you look at life expectancy for the years 2018, 19, and 20, compared with the previous triennium, life expectancy fell for the most deprived 4 deciles. Before I was talking about it falling in the most deprived 10%. Now it's the most deprived 40% for women, and in fact didn't rise at all for men. So we had an amplification of the inequalities. And local authority costs incurred and income lost as a result of COVID-19 and these cumulative losses. I won't go through them all, but it had a huge impact on local authority costs, as it did on individuals. Actually, strangely, in the first year of the pandemic, because of the furlough scheme and other expenditure, the economic inequalities actually narrowed a bit, but normal service was resumed in the second year, where we got a huge expansion of income inequalities. And in the first year, of course, rich people couldn't fly to the Caribbean or go to the opera or whatever they do with their money, so they got more money. Poor people were, to some extent, protected by the furlough scheme and other things. But when that finished, and particularly with the removal of the boost to universal credit, at a stroke, taking £1,040 a year away from the poorest people by the person who now thinks he'll be the next Prime Minister and looks like he's on the left of the Conservative Party. That unhinges the brain. Took £1,040 a week away from the poorest people. So the case I've been making is health is a measure of societal success. Pre-pandemic, life expectancy was stalling, inequalities were increasing, and life expectancy for the poorest people went down. And that slowdown was nearly the biggest of any rich country bar Iceland and the United States. And then during the pandemic, we had in the first wave, we had the worst performance of any country. Over the 2 years, 2020 and 21, we had the biggest fall in life expectancy of any country except the United States. And I ask, what's the link between our poor health performance pre-pandemic and our poor health performance during the pandemic? And I think it works at 4 levels. Oh God, I'm a slow learner. I think it works at 4 levels. Poor governance and political culture, increasing social and economic inequalities, the reduction on spending in spending on public services. We were ill prepared, and we weren't very healthy, which increases risk. And then the third is the cost of living crisis. The question which we academics like to ponder, but I think has huge practical implications too, is about relative versus absolute poverty. Now, relative poverty if Jeff Bezos's wealth went from $200 billion to $120 billion, then inequality's gone down. That doesn't seem very important to most people, I think. That's not a reduction in inequality that means relative inequality that's meaningful. But if every kid on the street has got this season's football strip and your kid hasn't, that's an inequality that is meaningful, a relative inequality. Your kid's still got a shirt on his back, but it's not the one with the latest star's name, whereas every other kid's got it and your kid hasn't. That's a relative inequality that's really meaningful. That's taking your place in society without shame. And Amartya Sen, great economist, philosopher, Nobel Prize winner, said relative deprivation with respect to income can lead to absolute deprivation with respect to capabilities. Translating that, it's not just what you have, but what you can do with what you have. Now, if public transport is subsidized, if housing is affordable, if it is possible to have a nutritious, healthy diet without a cost premium, education free at the point of use, healthcare free at the point of use, then individual income matters less. What you can do with what you have is far more able to you if services are provided. But the cost of living crisis, in the end, people have to buy food and they have to heat their dwellings. And all of these countries have been talking about the cost of living crisis. I talked about a social determinants approach to prevention. You've heard politicians say, oh, I could eat on 30p a day. Poor people just don't know how to cook. They don't know how to budget. And, porridge for breakfast, lunch, and dinner. They've just got the wrong taste or whatever. We published these data from the Food Foundation. If you are in the poorest 10% of household income, to follow the NHS healthy eating guidance, you would have to spend 74% of your income on food. Last night, I was talking to housing people, and I said, housing is a food issue. Food is a housing issue. If you're spending 74% of your income on food, who's going to heat the dwelling or pay the rent? And the lack of affordable housing means you've got less money to spend on food. And food insecurity, the Food Foundation published April 2022 that 15.5% of the population were in food insecurity. The latest figures published on Monday, that had gone up. Of families with children, 1 in 4. We used to say we were the 5th richest country on the planet. That's rapidly, we're falling down with the success of government policy. I think we're now the 6th or 7th richest. 1 in 4. Food insecurity means going a whole day without eating, not eating when you're hungry, not eating enough to satisfy your hunger. That's pretty basic. And 1 in 4 families with children is suffering from food insecurity. And this isn't because people are too lazy to work. 2/3 of people in poverty have at least one adult in the household working. In Gwent, slightly higher than the national average in parts of Gwent, 32% of children in poverty after housing costs. In London, child poverty before housing costs is of the order of 17%. After housing costs, it's 37%. Housing is a major contributor to poverty, less so in Gwent than it is in London, because housing's not as unaffordable, but it's still very important. A glimmer of hope from, I've got to count up prime ministers, wait a minute. Johnson, that's right, it was the one before last. We haven't got one at the moment, but anyway, the one before. Levelling up. And the government produced a levelling up white paper. In the white paper, I wrote a commentary on it for the BMJ, in the level, I was very approving of it, by the way, of the white paper. They had 4 missions, 12 objectives, and I said, if you meet these 4 missions and these 12 objectives, you will narrow health inequalities across the country. It was great. But in the white paper, they pointed out that when Germany leveled up, incorporating the former Deutsche Democratic Republic, East Germany, into the Federal Republic, they spent 70 billion pounds a year, 2 trillion euros over 25 years. Did it work? Well, not bad. Life expectancy in women in the East, reunification, and hey, that's pretty good. Closed the gap. Men, they didn't quite close it, but they certainly narrowed the gap. Pretty good. So Germany spent 70 billion pounds a year. The budget in the Levelling Up white paper was 4.8 billion over 4 years, 1.2 billion a year. And that's when the government was still prepared to spend money. IPPR North calculated that the 2021 Levelling Up Fund was £32 per person. The drop in annual council service spending over the decade was £413 per person in the North. So we'll take £413 per year away and give you £32 back, and that's called levelling up. Aren't we lovely? And now that's gone. When Rishi Sunak in the spring statement, he said nothing. Hang on, how many chancellors ago was he? I can't keep up. He said nothing about levelling up. There didn't seem to be any allocation at all. That's all pretty depressing. So that's why my colleague was writing to me depressed. Why I wrote back and why I began by saying, you are the solution, not just to my colleague's depression, but you are the solution to how we're going to make a difference. Coventry in 2010 declared itself a Marmot city. I went to Andy Burnham in Greater Manchester and said, Coventry's doing it, but you know, if Manchester did it, that would be really... So they said, right, we'll do it. And we did a report for Greater Manchester, Build Back Fairer in Greater Manchester. I did say, by the way, to Andy Burnham and the chief executive, could you not call it Marmot? My wife, it's a plea from my wife, she would like you not to call it Marmot. She thinks this is egomania on my part. And the response I got back was, too late, we talk about implementing Marmot. So when you talk about making Gwent a Marmot region, I just hope my wife doesn't get wind of it, you know, that makes it difficult. So I'm delighted. If it means not just my name, but it means something, then you are part of this social movement that we're building. Luton declared itself a Marmot town. We had a meeting of the Health Equity Commission in Waltham Forest. We did a report for Cheshire and Merseyside, Lancashire and Cumbria, and Gwent, the first Marmot region in Wales. Leeds has approached us, North of Tyne Combined Authority, Kent, the Southwest region. So I mentioned Coventry, Greater Manchester, Altogether Fairer, Cheshire and Merseyside, A Hopeful Future, Lancashire and Cumbria, Luton Town. And the partnerships, the NHS, of course, integrated care boards, the voluntary community and faith, social sectors. I'm looking at the gentleman in uniform. We've got the fire and rescue service and the police interested in joining up. Very important. Other public sector organizations. And we're starting to get business interested. Legal in general, big insurance, financial industry approached us and said, I have trouble with numbers. We have 1.3 trillion pounds under investment. And I thought, I didn't buy peaches last week because they were £1 each. 1.3 trillion pounds under investment. Anyway, but we'd like to know if what we're doing as a corporation could improve health and achieve greater health equity. And we produced a report and said there were 3 things that business could do, but the public sector likewise. Quality of employment. Second, goods and services that can be good for health or damage health. And third, the wider impact on the community, the environment, on purchasing and the like. And developing indicators is absolutely vital. Yep, you can see we've got a lot of indicators. But it's vital to get a handle on, are we making a difference? So that's the whole purpose of this now. You notice I haven't said much about Gwent because the work's just starting and going on, and I'm not the expert. I hope I will be by the time we've completed the next phase of work with you. But it's very important. It's showing, as Greater Manchester and Cheshire and Merseyside and those other regions, that whatever chaos is going on at national level, by people working at a different level, absolutely committed, being part of that social movement, really we can make a difference. And the question is, what would success look like in Gwent, and how do we get there? That's the purpose of the whole process of which today is a part. And to come back to what I said, we have to deal with these, my diagnosis of the quality of governance. Increasing social and economic inequalities have to be reversed. It's not just no more austerity. We have to reverse the cuts to services and deal with the fact that we're not very healthy. And often I get asked, what's the one thing you would recommend? One thing? Put equity of health and well-being at the heart of all government. Thank you.
Thank you. Thank you very much. Thank you, Professor Michael Marmot. Clear, informative, challenging and inspiring. Thank you very much. We're now going to move to a refreshment break. During the break, if we could please participate in the Mentimeter to cast your vote on the branding of the Gwent Marmot region, which will be on the screen. And if you could all make your way back here for about 20 minutes' time, that would be great. Thanks very much.
That includes you, Mr. Gatehouse. Do you want it? Or shall I? I will. Welcome back, everybody, to what hopefully you're finding to be a very uplifting morning. My name is Paul Matthews. I'm the Chief Executive of Monmouthshire County Council. Born in Cwmbran, really a man of Gwent, and I think Gwent is the key word for me this morning. When I asked to take this slot, colleagues in public health said, do you want to do a slide deck? And my straight answer was, how on earth can I put together a slide deck when I'm following Sir Michael Marmot? No, thank you very much. I'll just take it off the cuff. So, if you're not sort of interested, intrigued already by the agenda, by the things that have been shared with us this morning, then arguably you're in the wrong room. Because I think where I'm going to take you now is to the next part of our conversation. Michael has shared with us a lot of statistics. He's giving us a 10, 12, 15-year backstory on the work of the Institute. This is evidence-based work. I've been in public service for more than 30 years. I've been around top tables, either at chief exec or deputy level, for close to 20. And I'm stood here right now not knowing whether I'm feeling sad or whether I'm raging. And I think it's a combination of both. This is my place. This place matters to me. All of Gwent matters to me. And in the contribution that I've been able to make so far, it clearly has not been enough. That makes me sad. I'm not happy that the people that I know aren't having the life chances, the life possibilities that my two sons are having. Yes, they've worked hard, but they've had advantages that others don't have. And public service, whether you're in health, fire, police, council, wherever you are, I'm sorry to say, ladies and gentlemen, but in my world, it is not a technical venture. It just is not. Public service is about vocation. It's about heart. And we can spend all of our time worrying about the world as we see it. Yes, we can be fascinated about the dynamics of Westminster, many other dynamics as well. But ultimately, there is not another part of Wales that can pull together a room like this. There is not another part of Wales where somebody like me can stand here and look at all of the actors that can make a difference. We can choose to plant a flag. We can choose to do things differently. And we have agency. Yes, other people can help us. Yes, policy agendas need to align with what we choose to try to achieve. But ultimately, I would be neglecting my role as a public service leader if I ever allowed my organisation to become flotsam in somebody else's story. We have 600,000 plus people in the preserved county of Gwent. And just to remind those of you that are not sure, the preserved county of Gwent does in fact still exist. It was only Gwent County Council that stopped existing. The preserved county is still a real place. And having the opportunity to help partner organisations such as Gwent Police, such as Aneurin Bevan, operate on their full footprint, rather than perhaps need to reduce their effort and their action to ×5 or times whatever else it might be, is something that we need to think seriously about. So I'm really clear why I'm here this morning. I might be on my own. I hope I'm not. But I'm not here just to listen to Sir Michael. I'm not here just, I guess, to rehear the story. And I said to Sir Michael earlier, I feel as if I've stalked you for a decade. But sometimes there's just a moment, isn't there? There's a moment where you have the opportunity to say, this is now. We can plant a flag. We can choose to make a difference. But the people in this room have to really want to. We are the leadership cadre, the public service leadership cadre, for 600,000 people, most of whom will never ever know your name. And that shouldn't bother any of us, should it? That's not what we signed up for. It was never about ego. It was never about glory. This is about heart as well as head. And we can't possibly be happy on our watch in the remainder of our career. And most of us have got 10, 15, 20 years left in us. You know, this is not a time to be stalling. This is not a time just to be looking at statistics and grinding our teeth. We have to ask ourselves whether we have the leadership energy to do something about it. I know a lot of you in this room, not all of you. And of those that I know, there is not one of you that I would swap out for anybody else that I know. I know the talent that we have here. I know the ambition. And I love the fact that the preserved county of Gwent just holds such difference. And difference is a point of celebration. You know, we have rural, we have valley, we have city, we have coastline, we're a border. We have everything that could present a really strong proposition to be, and I will use the egotistical phraseology, a Marmot region. We have difference, we have real opportunity, but let's not shy away from the fact that we also have real challenge. We have the second most successful economy in Wales within Gwent. We have the economy that's struggling the most. We have that absolute divergence in a very, very small geography. But ladies and gentlemen, if this isn't the challenge of our time, what is? You know, do you really want to look at those figures in 5 years' time, 10 years' time, and think that they haven't moved at all? So I think the leadership challenge for us, or a leadership challenge for us, is to ask ourselves, are we good enough? Are we big enough to rise above the noise of the day? If I put every one of your diaries up on that screen for next week, there would not be too many blocks that are empty. But I would challenge you, as I am challenging myself, with the fundamental question, am I using my time in the right way? Am I doing the things that only I can do as a chief executive? Or am I being drawn down into my business? Am I being drawn down to places that I'm not creating environments that others should be able to manage? And my answer to myself is almost certainly yes. It would be very, very easy for a conversation about Marmot or a Marmot region to become a staccato conversation. We'll talk about it when we come together at a PSB meeting. We'll talk about it every third Friday of every fourth month. That would be very, very easy. But how do we design something that we're talking about every single day? How do we design something that becomes the leadership narrative of our separate organisations as well as our collectives? And many of our organisations are now resetting for the next 3, 4, 5 years. How do we design something by thoughtfulness rather than leaving it to chance, which gives us a better chance, a really good opportunity to build on all of the collaborative things that we've done previously, the really genuine collaborative endeavour at service level, at project level, at programme level. But this is something else. This is a call for collaborative endeavour at societal level. That, in my view, is real contemporary public service. That's about reformation. And I think, if I'm understanding, Sir Michael, the agenda appropriately, that's really what we're talking about here. You know, it's not one of the determinants. You know, we can't pick number 3 or number 1 or number 8. This is a fundamental model which asks profound questions of us. I think we're up for that. I think we're up to that challenge. I'm very genuine in believing that Gwent is the most networked part of Wales. But have we really, honestly, brought that to bear with full force to this point in time? I've been around a while. I'm not planning on sort of falling off this stage anytime in the next sort of 10 or 15 years. I might step off it in the next 30 seconds, but I'm not running away from where we're at. I'm hoping you're feeling the same. I'm hoping you're asking yourself some pretty profound questions about how you take this morning back into your organisation. I'm hoping you're asking yourself how you're going to share it and how this is going to become part of your leadership narrative. And that's where we go next, ladies and gentlemen, in terms of the morning. We now have 25, 30 minutes for you to have conversations on your table. We want you to really think about what you've heard from Sarah, from Sir Michael, from Sean by way of introduction. We want you to really think about that and ask some direct and pertinent questions, or look for points of clarity, because in about 30 minutes you're going to have the opportunity to put, I guess, the product of your table consideration to a panel, you know, including those individuals. And I think we're looking for a really candid exchange. Nothing we're talking about this morning is easy. If it was easy, we wouldn't be here talking about it, would we? This is profound stuff. So there is no such thing as a silly question. We're looking to use this time well, and now is your time, really. Pick the bones out of what you've heard. Add more things in. Air your anxieties. You know, if you have concerns about being able to march forward with this agenda, let's hear them. Silence is not a good thing when we're potentially at the start of something that could be fundamental for us all. So, if we can go into those table-based conversations for around 25, 30 minutes, we'll call you out when we're ready. If you can think hard about the 2 or 3 points that you'd really like to bring out for the benefit of the wider audience, that would be really, really useful. We've also got people with us online, so we have the capability for those individuals to engage as well. And whoever is running the technical platforms, I think it's you, Caroline, isn't it? Or whoever it is, we'll make it very, very obvious to our guests online how they can engage and how they can sort of throw out 1 or 2 things that they may also want to bring to the fore. But that's where we're at. That's the link. For me, this is our county. We're all of this place. This is not a technical endeavour. This is vocational. This is a contemporary reformational service call. We have, I think, genuinely a titan of public service with us this morning. Let's make sure that we take advantage of that. But let's not leave this conversation in this room. Your leadership responsibility, it's not an ask, it's a responsibility, because we've all already signed up for this. Our collective responsibility is to make it so. You know, that's the leadership dynamic, that's the leadership ask, and we need to make sure that we've got the collective will to do that. I'll pass over to all of you to enjoy the next 30 minutes.
So we're just going to move to the question and answer session. Hopefully you haven't come up with anything too difficult in your tables. And then we will play the film at 12:45, recognising that we were aiming to leave at finish at 12:45. So we'll play the film at 12:45, and for anybody who absolutely needs to leave then, if they could do so quietly, but we'll finish the question and answers in time for the closing comments by Stephen Vickers, and then we'll play the film. Okay. No, I was going to put it.
So we're going to move into the question and answer panel, obviously. So for those of you online, just a reminder, if you can just keep using your the question and answer function, which is on the Vimeo platform, to ask any questions. They'll then be sent to me up here so I can ask them for you on your behalf. And obviously, those of you in the room, we've got 2 mics. So if you can raise your hand on the table, we'll take questions in turn. So there's a section in Sir Michael's book, The Health Gap, about the organisation of hope, and I think that's what some of today is about, how we combine government, knowledge, and then people to make these things happen. So would anyone like to start with the first question? Okay. Sorry, yes, okay, thank you.
Hi. So we were just really wondering, obviously we've got, the hearts and minds of what we actually want to do. We all feel that we're fully up for the challenge. But how do we embed Marmot into all of our organisations and make organisational cultural change to make an effective difference?
Would you like to answer that,
Is
Sir
that
Michael?
me?
Yeah, I think so, probably. It's
absolutely the right question, because what we've been talking about, I've been talking about, is the content, but the cultural change is also vital. And I think the cultural change has at least 2 important aspects to it. One is the organisation of hope. I used to go around the world saying I was an evidence-based optimist. And a Brazilian colleague sidled up to me with his Brazilian Portuguese English and said, "Michael, you are using the English language incorrectly. You're not an optimist, you're hopeful." "Go on," I said. He said, "An optimist believes things will get better. You're not making a prediction about the future, you're hopeful." And I'm very grateful to my colleague. It's a very important distinction. We're not sitting back saying, will things get better? The culture shift is to say, if we work at it, we can make things better, we can change the future. And that is an important cultural difference. And I think the second part is a recognition that no matter how difficult the environment, it's always possible to improve things. And my inspiration came from when I was chairing the WHO Commission. I said at the beginning, if governments don't care, or worse. We're sunk. What can we do with the country? And one of our commissioners, Mirai Chatterjee, who is a leader of the Self-Employed Women's Association in Ahmedabad, in the Indian state of Gujarat. Self-employed women sounds like public relations, freelance journalists, not in Ahmedabad. These are women who stitch a few clothes, clean refuse off the street, sell a few vegetables, the poorest, most marginal women in India. And by collective action, Seva got together and makes a dramatic difference to these women's lives. So she said, if government won't do it, we'll do it. And we'll do it for ourselves. But it's collective action. So when an individual says, but what can I as an individual do? The answer is join a group. That's what you can do. Become part of a social movement. So I think both saying the attitude of we hope we can change the future and recognizing that it has to be part of social action, that we do this together in a coordinated way.
Could I just add something?
Yeah, please, Sarah.
So I think for those of us in the room today, the question is how are we going to spread the hope? Because I'm hopeful that anybody who's here today, as I always am, is thinking I've got to go out there and try harder. So, but for us as the Gwent Marmot region, then it's into how are we going to spread that hope, engender that belief that collective action can make it better. It's not going to solve everything, but let's at least do the things that we can do. So I could bore you with the process of what I think we're going to do next, but I think the key message is that it's about everybody here going out and engendering that hope and that belief.
Thanks, Sarah. We've got a great question online, so perhaps move on to that one. So Lisa Friel from Blaenau Gwent Local Authority is asking, how can we ensure there is true collaboration regionally, but also how can we grow that and make sure the process works in a national context? So perhaps someone from the PSB would like to take that one.
Well, to say, I'm not quite sure this is answering the question that was intended, but how can it influence the national context? One of the things that we're now trying to do, well, not trying, we're in the process of doing, is setting up a health equity network. So the idea that these Marmot towns and cities, great that they're doing things, but that they join a network where they exchange information, learning experience, mutual support. Have you tried this? This is how we're doing it in Gwent. Oh, really? This is how we're doing it in Waltham Forest. What's Gwent got to do with Waltham Forest? Well, this is how we're doing it in Cheshire and Merseyside. So we're trying to set up this network where there can be mutual exchange. But something else, I was talking to a group that call themselves the People's Powerhouse across the north of England. So George Osborne set up the Northern Powerhouse with the idea of investing in infrastructure and the like. And they call themselves the People's Powerhouse. They want to improve lives for people, not to have faster train lines. And so I was talking at their meeting and I said, my private hope was that we'd get so many local areas involved in action on the social determinants and health equity that national government would have to follow. They'd run behind this pack and then they'd run round the front and pretend they were leading it all along. And they'd have to follow. And it was then pointed out to me, you said it was your private hope, but you just said it at a public conference, so it's not very private anymore. So I think get enough Gwents working together, and we will change the national context.
I completely agree, and I think for us it's the community level. You know, there's how we sharing across communities and enabling communities to do everything that they can do with our help. But we have had the conversations with government, who are well aware of the fact that this will generate examples of where government are being helpful and where things that government are doing are not helpful, and it needs to be a two-way conversation. But I think there's two parts to that, isn't there? But let's not lose sight of the power at local community level. I completely agree with the private hope.
I think the question was, how do we ensure collaboration? My view would be that you cannot ensure collaboration, but you can create the conditions that make it more likely.
Yeah.
I'm looking at a lot of them in this room. You know, we can't understate how people listen to the things that we say. They look at whether we're smiling or whether we're frowning. They check us out for consistency over time. They look at the way that we describe the purpose of our organisation. They look at the way that whether our values talk to that purpose. Trust builds over time through normative learning, through doing things together, doesn't it? And I think one of the features of the conversation of this morning is that we're not looking for something that's going to be a week, a month, a year. If we decide to embark on this work, we're going for a very, very long time. Some of us will stay the course for a year, 3 years, 5 years, 10 years. Others will be taking different directions, and we'll be inviting others to join. So how do you build the story? How do you tell the story? Narratives and storytelling are fundamental to looking to build environments that make it more likely that we'll see collaborative endeavour. But I think a danger for me is that sometimes we can look for the other person or the other organisation to be doing it. It's our action. It's the way that we choose to position. And it's the way that, in my experience of working in partnership and with partners, you genuinely have to believe that, and be prepared to offer more than you expect to receive. Now, if we can start from there, and if we can be finding 5 people a week that we're having conversations with of this nature that we didn't touch last week, then over time and with consistency, I think we give ourselves a chance. I think WG, for what it's worth, we have a very prominent sort of senior colleague from WG with us this morning. Why wouldn't they be interested and fascinating in this agenda? Professor Marmot's already indicated you're doing other work with ministers at a governmental level. So it might not be precise and it might not be firm, but the pieces that we need on the table are on the table. Do we want to play with them? My instinct is we probably do. So can we ensure? I'm not sure. But can we lead to it or create conditions that make it more likely? I absolutely believe that we can, both with optimism and with hope, actually. I believe that can happen.
I think it's incumbent upon us to create those conditions for collaboration. The picture that Professor Marmot painted, how the economics affect health and inequality. My own council area, under austerity, and in its worst year, it had to look for £14 million black hole. We're now looking at a £40 million black hole in the budget. So we are not getting help from where we would like to get the help. So now it's incumbent upon us to create those correct collaborative conditions. And as you say, the people are here in the room to do that.
Thank you very much. Should we take another question from the room? Errol here. Is that okay? Thanks, Liam.
So lots of hope and lots of motivation from my table. The question that we had was, what does good governance and stewardship for achieving health equity look like? And what was behind that question and some of the discussion around it was, given some of the decisions that we'll have to make in the coming months with respect to how we use resources, how do we ensure that those decisions and the actions that we take don't impact detrimentally on health equity? That was our question and some of the discussion behind it.
Well, the piece that I refer to, the ill-starred piece that I wrote for the BMJ last Friday that's gone through 3 iterations since, my lament was that there was no sign that health equity was anywhere in the government's consideration. Not in Liz Truss, not in Jeremy Hunt's, depending who, my phone and thing keeps flashing up saying support for Boris Johnson growing. I think, what kind of time warp are we in? And he's not going to put equity of health and well-being at the heart. So that's a real problem at the national level. You've got much more chance at the Welsh level of that happening, of it being a priority, an outcome of government. The Future Generations Act very much has that at its heart. It is hamstrung by the funding settlement from Westminster. I mean, whatever it is, £15 billion a year net that flows from Westminster to Wales, cut that by a bit, and it creates real hardship for public services in Wales. But nevertheless, by saying that equity of health and well-being is the key thing on which we're focused, and preserving the planet are the 2 key things on which we're focused, and making them the drivers of these very difficult funding decisions that are coming down the track, rather than saying, well, we can't worry about that, we've just got to slash spending, but reorienting the whole way one actually approaches it. And I say there's more chance of that happening in Wales than it is nationally in the UK.
If I may, Errol, I think it's a great question, because there have been occasions during my career where I've wanted to go a little bit quicker than maybe some others, but appropriate governance is absolutely key. And I think it's useful for us to reflect on what's within our gift. We have a public service board for the preserved county of Gwent, covering 5 civic areas, the only one of its type, to my knowledge, in Wales. The people that make up that maturing public service board, to my recollection, have already decided that they refuse for that public service board to become a clearinghouse for every issue of the day. Through the genesis of our well-being plan, which in its own right has been, a really significant exercise, the Public Service Board has decided its focus. It's 3 areas, and the content of the morning runs through those 3 areas. A challenge, I think, for the Public Service Board is to hold that ground and to continue to ask the question, what is it that only we can do? The Public Service Board basically doesn't have a penny by way of budget, but it has all of the significant leaders and institutions that make up, or the vast majority of significant institutions that make up Greater Gwent. The people on the other boards in Greater Gwent that have money are largely put there by the people that sit on the PSB. So we're at a new point of genesis, aren't we? But we have it within our gift, if we're minded to reframe the decision-making, the thought processes of other significant partnership bodies that we have significant stakes in. It's not going to happen by Sunday or next Tuesday. But one of the conversations that we often have in different groupings is, what's the relationship between the Public Service Board and the Regional Partnership Board? You know, for those of you that are not sure what a Regional Partnership Board is, it's largely a health and social care construct and is a conduit for many millions of pounds into the preserved county of Gwent. That relationship is not yet struck, I would suggest, is the answer to the question. But in time we will want it to be, won't we? We'll want that good balance. So we'll want the things that the Public Service Board have determined to be the most significant issues for the preserved county of Gwent to be the things that are determining the actions of boards that work in that same environment. You know, if we want to achieve a perfect hierarchy and a perfect sequence, I think we'll drive ourselves nuts. But you know, I think we can achieve a better alignment than we've perhaps had in the past. And our goal on governance should be for it to be really good, but only as heavy as it needs to be. You know, sometimes there are dangers that we become preoccupied with governance. It needs to be good, but it doesn't need to dominate our conversation. So I think there's a balancing opportunity. But if the PSB hold the space and the approach that I've observed so far of really focusing down on the things that only it can do and refusing to have 10 items as a strategic agenda, it gives itself a chance to exert influence. And I think that would be a significant net positive for us. So the answer to your question in simple terms is governance really, really important. Are we where we need to be yet? No. Are the pieces coming, you know, I think, are they in sight? I think they will be, and they are. We've got the ability to do many things ourselves. And if we do them well, I suspect other parts of Wales will want to emulate us. You know, it's perfectly appropriate sometimes to be a step ahead and not necessarily need to follow. I think that's what the maturity of the relationships that we have in Gwent gives us the opportunity to do.
Thank you. Okay, there was a question over here, and then, thank you.
Anthony Hunt, leader of Torvine Council. Very much agree with Paul in that, you know, governance is the ultimate sausage machine, isn't it? I don't really care about it that much. I just care about what comes out the other end, but maybe that's just me as a politician. The big message I'm getting from today is that we know our state needs to decentralise. We know that public services need fair funding, but you know, we can't afford to wait for the government to do those things. We need to take action ourselves, to look what we can do, to look where the power that we have to make a difference to our areas, rather than waiting around and expecting government to solve our problems. And so that's the real challenge that I feel coming out of this room. We've got a lot of power in this room between the public service organisations that we run. How can we work together to make a difference, rather than expecting central government to come to our rescue, because they're not.
Who would like to pick up that?
Well, one of the lessons that I learned early on is that whatever knowledge my colleagues and I have accumulated from reviewing the evidence, talking to experts and so on, that's not enough. The working with communities, working with people who are experiencing health inequalities is absolutely vital for a whole variety of reasons. But key is the process is important. The process of engagement is important. And second, innovative solutions. So we do have knowledge of, in principle, what needs to happen, but how to make it happen in the particular conditions of Gwent, or parts of Gwent, or the other regions we're working in, that's not knowledge that we have. It may not even be knowledge that you have today, but it's knowledge that you, in partnership, can develop over. That's why the process is important, of how to do this and how to make a difference within the constraints, the social, political, economic, environmental constraints that are upon us. And that's vital. The community engagement and working out ways of doing this that really makes a difference. And there's ample evidence that if you break those rules, things don't work as well.
Thank you very much. If I could just bring in a question from online on the back of this. It's a wicked question, but a wickedly wonderful question. Paul's already mentioned about sort of a long time horizon. How will we know when we've succeeded? Is it just about the gap? And how will we measure that?
Well, I put up, just right near the end, an example of the monitoring framework that we developed in Cheshire and Merseyside. We have a similar one in Greater Manchester, 24 Marmot beacon indicators. Actually narrowing the life expectancy gap takes a long time. Well, it might take a long time, and that's the outcome perhaps, but that takes a while. But having indicators of the changes we think are important steps in getting there, that's doable, and you can monitor them in real time and say, so readiness for school, proportion of children age 5 that are ready for school. That can change very quickly, year on year, and you can monitor it. It's an important outcome. Children getting a certain benchmark through schools, whether it's the level 8 or GCSEs or whatever the appropriate, you can do it. Food insecurity, it changed in a few months. You can measure it in real time. And fuel poverty. So developing an appropriate suite of indicators is vitally important part of the process. Populating them with real measurements and monitoring as we go along is an important part of the process.
I think the only part I'd add to that is I think I'm just agreeing out loud, really. Having a diagnostic capability, which is as close to possible as being a real-time diagnostic capability. And if we're feeling brave enough, courageous enough, and we believe in transparency, making that publicly available in real time. So it's not locked within the public service. It becomes a community resource, which can help us think tactically, perhaps, about things that we're doing, as well as strategically. And if we know anything about evaluation, the strongest evaluation is dynamic evaluation. So I think, Sir Michael, I would agree with you. It's not something that we need to pitch into and wait 15 years and hope that it's working. There will be some observable trends, I think, in some of those 8 areas that would either give us confidence that we're on the right track, or they will tell us that we're not. So we may well need to pivot and adjust. The only other point that I would add is that clearly we're sat here today with a new friend, aren't we? You know, it's an international Institute of Health Equity that hasn't played here before. That gives us capability that we wouldn't probably be able to generate for ourselves. So in its own right, it's an example of how we can perhaps get ourselves in a position for a better start by utilising knowledge in others that have gone places that we wish to go to.
Can I just add, sorry, that one for which we can take no part of the credit, Swansea got involved in reducing the proportion of young people not in employment, education or training, NEET, a few years ago. They went into schools, they identified kids they thought were at risk of becoming NEET when they left school, and they intervened. They did reduce the proportion of young people not in education, employment or training. violent crime went down. So that was not the intended outcome, but violent crime went down, which is why we can make common cause with the uniformed services that take the interventions that improve the lives of young people, and there'll be other good outcomes, but we need a proper monitoring system to be able to detect that, as they could in Swansea.
And that actually might be one of the first steps for the Public Service Board. We certainly have, amongst all the members of the board, they got those metrics already in place. We're already measuring many of those things, so we need to create that page where we can simply look at it, and you can look at it month by month, year by year. Yeah.
I was just going to say exactly that. I think that's one of the things that's entirely within our gift. The measures exist, and that's something we should aim to do fairly quickly, and I think then have the conversation about, are we going to share it publicly? Yeah, that's another that goes back to the question about culture, doesn't it? If we're actually really serious about this, then we develop the metrics and we share the dynamic metrics as to win the hearts and minds as we go along.
Thank you. There were a couple of questions. I think Kath was first, then I'll come back to you straight away. Is that okay? Thanks, Kath.
Thank you. Several questions from us, but one of the first ones that we talked about was, and I suppose it comes back to Paul's comment, nowhere in Wales would you get a room full of people like this, and it just goes back to the fact that we are local authorities that work well together, coterminous with police and health, and that the Public Services Board's got a real opportunity. The preserved county of Gwent, there was a medieval kingdom of Gwent. I think we should start using that, because that's kind of the position where we are. But what our question is, what would have the biggest impact? What are the silver bullets that we can pick up, maybe from the other Marmot areas, and employ in Gwent immediately to make the biggest impact? And then how do we extend that learning to other areas in Wales?
Sarah, do you want to?
No, I was good.
Sorry.
No, I know, I definitely was. I was actually just in the housekeeping of keeping an eye on the time. But I'd invite you to go first on that one in terms of what the evidence suggests. So if I have to say something, I will say something. I think collectively the opportunity for us to provide routes into good, fair work is, to my mind, one of the things that we could do relatively easily. There's lots we do about making it as difficult as possible for people to find work with us. And if we developed a collective approach that recognised skills and enabled people to develop skills and move between our organisations, that I think is something that is entirely within our gift, because it's about how we work and could make a big difference. So that's one of the ones that I keep coming back to.
In Coventry, firstly, we haven't done a controlled experiment, although Coventry has just got funding from central government to do work on health inequalities. But in Coventry, looking at the indicators, the percent of children with a good level of development, age 5, improved. The proportion of young people not in education, employment or training went down. The proportion of people earning a real living wage went up. So that's 3 markers of where they were able to shift the dial. Did they shift it more than would have happened without it? We don't know. So it's not a pucker proof. But they're indicators moving in the right direction, if you like. They're proof of concept. Picking up what you said, our proposals are not to do a whole new research project on developing new indicators. It's using indicators that are available and looking at them in an intelligent, structured way to inform. So the purpose of setting up this network is to answer your question of what could we learn from the other areas.
Last question.
We have time for just one more, so let's take the question over here. Thank you.
Thank you. Jeff Cuthbert, Police and Crime Commissioner for Gwent. Can I say the issue that you raised about Swansea, the work in Swansea, where to intervene with young people in terms of training, and then you saw a reduction in crime, is certainly correct. There's plenty of evidence to show that the right diversionary activities, giving employment opportunities, reduces antisocial behaviour and criminality. No issues whatsoever. So my question is this, and it's only a question. Might it be more productive if we focus our combined resources on working, not necessarily exclusively, but mainly with the youngest generation, so that they can learn the right skills to go forward into adulthood and perhaps help to educate their own families on the way? Might that be a more practical way forward rather than spreading our resources right across the whole population?
Well, I got two responses. One, a discussion that I've had periodically with a very influential economist. And he said, look, if you're sitting in government and if it turns out putting up more security cameras reduces crime, why would you want to invest in educating young people? It's cheaper. Put up a few more security cameras and you've reduced crime. Don't bother about educating young people. Any government would choose that. It's the more cost-effective solution. And I used to have a lot of hair, but I pulled it all out when I was talking to him. Well, because somehow that doesn't do it for me, I'm afraid. We're not just trying to say, how can you run government in a cost-effective way? Give poor people cigarettes. Let them smoke themselves to death. That'd be cost-effective, but highly immoral. Highly immoral. We don't do such a thing. So my first problem is that we need to be doing things not only because it's the best use of resources, but because it's the right thing to do. And I don't think you and I are differing in our view of how important it is to invest in early childhood and young people. My second reaction, though, was I was at a conversation last week with the International Longevity Centre that are concerned with the issue of older people's well-being. Are you going to go out and campaign and say, let's remove the triple lock on pensions so we can put more money into early childhood? I think we have to do both. We have to make sure pensioners are not living in poverty or in any greater poverty than already is the case. At the same time, I think I've just been cut off. Someone's saying it's lunchtime. At the same time, that we have to be putting a great deal of effort into early childhood and young people. So these are not either-ors. Somehow we've got to, which is why I've always resisted choosing one. And my response to what's your priority? Put equity of health and well-being at the heart of all policy. And I wouldn't say cancel today's older people so we can invest in early childhood. We have to do both.
Thank you. So I think we could all thank the speakers today and the panel. We're going to have a very short rearrangement of the stage, and then we're going to hear from Positive Futures, Steve and Lucy, who are going to show us an example of a really great project in action and how it can turn lives around.
instead. Good afternoon. I'm not going to keep you too long, or we're not going to keep you too long. Just like to introduce a program that is operating in Newport. So my name is Steve Ward. I'm privileged to be the Chief Executive of a not-for-profit charity called Newport Live, set up by the City of Newport some 7 years ago to deliver leisure cultural services. We had the insight to make sure that we could deliver right across the community. So there are a number of programs that we started at that point that still run with us now. And I'm certainly proud today to say that we actually work together as Gwent without a formal partnership in place, but we work as leisure operators and people who are in this sector to make sure that we share good practice and learning. Now, we're not a statutory funded entity, but I think you'll see some value in what we do, and we exist because of the generosity and the support and the value that we offer back to partners. So whether that be the national partners, the City of Newport for us, the Office of the Gwent Police and Crime Commissioner, which you'll hear about in a short while. So I'm going to stand down and allow really the architect of our programme, who is, and it resonates with what people have said today, this is a vocation that you work in. So you're going to see the impact of a program that we deliver, which really has a massive impact. One of the streams that we deliver on health inequalities, and this will focus on young people. So my colleague Lucy Donovan, who heads our Positive Futures program, is going to come up and take you through the real story of making an impact in this city of Newport. Lucy.
Good start. Okay, so it's great to be here. I'm not going to keep you too long. So my name is Lucy Donovan. I manage the programme in Newport, and I'm like a sort of an advisory role across the Gwent region. The projects are not like for like, but what I'm going to just try and run you through is what we're seeing on a day-to-day basis and the delivery model that exists. Okay. That is a picture in Pilgwentley and Newport. Hopefully we've captured what life can be like and what it looks like on a Friday night. Okay, so what are we? What is it? It's a youth engagement, social inclusion programme that does tackle inequalities. We are trauma-informed in our approach. We are strength-based. We're non-judgmental. We use sport and physical activity as the main engagement tool, and it's predominantly for marginalised young people who are aged between 8 to 18 years of age, living in this Gwent area that we've all been talking about this morning. So it started in Newport in 2002, probably showing my age here a bit now, through a Home Office funded scheme. Come 2013, that was directed to the Police and Crime Commissioner's offices. Unfortunately, the OPCC said, yeah, we recognise it, we see the value of it in Newport, we want it replicated throughout Gwent. So hence why we're talking in a Gwent context today. What is the delivery model? So what does it look like on a day-to-day basis? So the bottom of the triangle is the open access, voluntary engagement. We are in the heart of the community with trusted adults who've got relationships with young people, that those young people could come into sessions free of charge and be a young person, take part in sport, talk to staff, feel safe, because some children and young people don't feel very safe in their communities. We're there consistently, we're there repetitively. We're not going away, and we want to know how you are and how your week's been. The targeted group interventions, we reference this often as early intervention, so it could be that young people are being flagged by different services. We're worried about so-and-so. There's a group of children that we want to talk to. We want them to understand about healthier relationships. Once you get to the age where you have a relationship, what should that look like? What is acceptable? What's not acceptable? It's that preventative approach of actually chatting with a group of young people where I might have chatted to my parents or my peers. Some children and young people haven't got that. So that's what that is about. And then the top of the triangle is the one-to-one trauma-informed approach. So I'm sure many of you understand what's happened here as opposed to what's wrong with you. That is pivotal to what we do. It's not a judgment of your behaviour is unacceptable, this is a consequence, this is going to happen to you. It's actually, tell me what's going on. I can see you're hurting, I can see there's pain there. We feel passionately about that. How does it happen? This has been mentioned a lot this morning, thankfully. It's longevity. What I said earlier, this happened in 2002. It's 20 years' time, I'm still here. There was someone else in post before me, well, 2 people, but saying the same thing. So it's consistency. That is key to making a difference. Children and young people are not stupid. If you don't care, if you're not coming back, they know that and they're not invested. There's other people in the community that are there all the time, that have got the gear, that have got the idea, and they're good to go. So we've got to battle against that. We've got to be that better offer than what the guy down the street might offer. It's multi-agency. We use sport as a tool. We are sport for development, but we work with partners locally, regionally, and nationally. So within the team now in Newport, we've got a youth justice service worker. He's embedded within our team. The value that has brought to the team, we can't measure that. We've got a community psychologist. She comes in and works with us once a week. The children we're working with, they're complex cases, and often we feel like we might get held with that case, but we want to know how to support that young person in the best way. They might befriend us, they might look up to us, but we haven't got all the answers. So use us. We've got that connection. As we always say, connection before correction, and we can help that young person. So if it is a social services meeting, if it is a police, a Section 47 meeting, we can be that voice for that young person. It is direct delivery. I'm not just talking about ideas. My staff will be in Pill tonight. I do get the phone calls. I do get, what am I supposed to do? So-and-so's got a knife. I'm worried about this young person. What happens? And that's 7, 8 o'clock tonight. That'll be happening. And that's week in, week out. We've got people that are invested in this. Steve and I were talking, it is a vocation. It's not an easy task. It's difficult out working out in the community these days, but the trusted adults, they're a safe face with a safe place to go and speak to about these things. And the funding. OPCC, I've mentioned it already, local authorities via Welsh Government funds. This is critical for us to maintain. If we haven't got that and we don't know that we've got it each year, I can't build the team. I can't say, oh yeah, leave your job over here and come and work for us, but actually I don't know where we're going to be in 4 or 5 months. That is huge. I think my film might play. Yeah, I'm going to stop rattling on. I'm going to let you watch this film. It's only just up to 5 minutes.
Young person growing up in Newport is quite gritty. You've got a young guy who's 9 or 10, being told by his brother to carry a knife because that's the only way he can keep himself safe.
The film said it all. I'm not going to go on for too much longer, but just to reinforce the point that it's a child-centred approach. It's non-judgmental. It's a safe environment. It's adverse childhood experiences, adverse community experiences, but actually connecting before you correct. So we have that relationship and we want to talk to the young people before it gets to crisis. That importance of prevention. It's not react, it's get in there first. What does it look like? So last year, the whole Gwent-wide programme engaged over 4,000 young people. I'm not a massive advocate for data because I look at that and think, well, so what? But actually, in terms of their mental and physical health, the importance for a young person to feel part of something, to belong, to have an identity, that's what a lot of them are craving when they get sucked into these gangs. That's what we're trying to do. We want to be those people that they can go and talk to. It's the physical health. I know myself, I'm getting stressed. I need to get to spin. I need to go and exercise. I need to get out in the fresh air. Some children and young people haven't got that as a guidance, but we can be there as a free opportunity for when they're really struggling. And quite simply, be part of something positive. I wanted to finish on this quote. We've been working with Katie from I come from Gwent Psychology, Child and Family Psychology, and she introduced Dr. Bruce Perry, his work to us, and I thought this summed it up lovely. Think about how you've handled difficulty in your own life, with things that are very hard to deal with. You don't want to talk about the pain or loss or fear for 45 minutes non-stop in a clinical sense, across the table with someone staring at you. You want to talk with a really good friend for maybe 2 or 3 minutes about some aspect of it, but when it gets too painful, you step back and you want to be distracted. And maybe you want to talk more later on. It's that therapeutic dosing that leads to real healing, moments that are fully present, powerful and brief. That's what we do. It's at the side of a football pitch, it's in a mugger. Tell me how you are. That's just our contact details. If you want to get in touch, we've got socials, we've got website, and that's my email address. I'm just going to hand over to Steve to finish off.
Thank you, Lucy. I hope that's given you an insight into one project that started to look through one lens 20 years ago. Welsh Index of multiple deprivation, Newport, for certain factors, were top 50 in the UK, so we managed to get some funding from the Home Office, and it's evolved. But it does tackle many inequalities. You see some faces when I stand out of the way, but ultimately the power is in our hands. The power is here. You know, a proud Gwent person. First thing I think I ever won in sport was to be a Gwent champion. And that was really, really important. And I think working together, playing together, and being successful is key. But one key thing, and I'm an advocate of well-being, an advocate of physical activity, but also have learned a lesson that that's not for everybody. And some things are mental health, you know, physical health. That well-being journey and that circle is so important. And to hear Professor Marmot today, and many other colleagues, but to put one thing in context for me was to say, why treat people and then send them back to the conditions that made them sick? And those of you out there who go and see medical practitioners, they'll deal with the illness. Now, there are well-being and wellness services out there, and there's a whole army of us across Gwent that we need to tap into. And these are people who work in the vocation area who want to make a difference to people's lives. Like Lucy, like other colleagues I met in the gym this morning, colleagues will be in the streets tonight and in different communities. We need to use those as an army, because the people in this room, you're not going to touch the surface. We need the voluntary sector. We need all of these sectors to engage to make that difference. And the impact that they make on health inequalities, if we stop that tomorrow, would be enormous. So I think we do have a massive challenge. The system and the way that we can involve one another and engage, especially with diminishing resources or competition for resources, is going to be tough. But there will be ways to make efficiencies. There will be ways to have early intervention and stop spending money in certain areas because there's more cost-effective ways. And they're going to be tough conversations for us all to have. But I can promise you that if you're looking at health inequalities and you're looking at people who work in the well-being area and can make a difference, there is a willing workforce in Gwent ready to be engaged and to serve and to work as part of the Gwent-wide Public Service Board and to embrace the Marmot principles. And thank you for staying, thank you for your time, and thank you for some amazing presentations today. Thank you.
Right, the most impressive thing today is to see Sir Michael jumping up and down on this corner here. I daren't do it. I've had to walk up that step there. I just wasn't taking the chance. Look, first of all, well, thank you for staying. I was expecting this to be a bit like the King Power Stadium at half-time with Leicester being 2-0 down. I'm from Leicester, so I can say that, by the way. But you've done well, you've done well. I'll start off actually with what we've just seen from Steve and from Lucy, the positive futures from Newport Lives. I mean, that's a great story, isn't it? Really inspiring stuff. I don't mind telling people this. I come from a background just like that those children at the beginning of that. I know what a difference that would have made to me early in my life. I can't watch those films now without getting a tear in my eye. I can't even watch X Factor without getting a tear in my eye. My children take the mickey out of me for it. But it's truly inspiring stuff. It is very, very emotional. So, you know, I think it's fantastic. I will promise you I'm not going to keep you more than just 2 minutes, and that's it, because we are an hour late already. It is a duty and an honour for me to thank everybody who's contributed today. The organisers, of course, the facilitators, the speakers. And thanks, obviously, to Councillor Morgan for his leadership as the chair of the PSB and for opening today's event. Sarah and Paul, obviously, for each of your contributions today. Again, very inspiring stuff. Paul, all I'll say to you is you had me at hello. It was fantastic. Of course, Sir Michael, well, first of all, we're glad that we could offer your colleagues some psychotherapy, of course. But we are even more pleased, of course, that you've taken your time to join us, share your experience and your wisdom. In one way, I think I should apologise to Sir Michael, because there's no doubt about this. I know this. I've worked in Coventry in one form or another, and Marmot means something in Coventry. It certainly means something in Manchester, and it will mean something to us, and it does mean something to us here in Gwent. We probably should apologise to your wife as well, because Marmot is going to be a reflection for us all for many years to come. I think Sir Michael and Sarah both set out the challenges really over generations, didn't they? Health outcomes, life expectancy, inequality across our region, our places, our communities, and clearly it's getting worse. Sarah said, didn't she, if we keep doing the same thing, we'll get the same outcome, and we need to transform. And for me, I think Sir Michael asked a critically important question during the session. What kind of society do we really want to live in? And he points out that perhaps to a large degree we're not really having the right debates. Well, in Gwent we're going to. I think we can thank, I've given some thanks for those here today, but we probably need to thank those that have been involved in Marmot for much longer than we have. Those involved in the Marmot reviews, and of course those who have implemented Marmot across their regions, because we've got a real chance to stand on the shoulder of giants there. They've really given us an understanding and helped to define our challenge. They've given us a roadmap to meet some of those challenges. But while some of that work will have been done for us, they can't do the heavy lifting for Gwent. That's for us to do. And for me, it boils down to a matter of priorities, focusing on the right things, and a commitment of all of our collective resources, which, when you say it quickly, sounds pretty easy, doesn't it? But we've got to be honest with ourselves and understand what it is that we're signing up to. We know, don't we, and we've seen it, when a crisis is thrust upon us, we rally, we mobilise, we work together, we overcome. Austerity, COVID, cost of living, they've all been mentioned today, and we've responded. So, understanding our challenge is important, but the important question is, what are we going to do about it? Leading in today, actually, Paul, on more than one occasion, has challenged members of the Gwent Marmot group. He's not really asked the question about do we understand inequality and the challenges around it. What he's asked is, do we really understand what it means to truly embrace the Marmot principles and become a Marmot region? The commitment of resource, rethinking what we do and how we do it. Paul's question, for me, is about true commitment to transforming ourselves. And I think that's what we're signing up to today. Gwent's leaders are in this room. And if it's not us, then I ask, who is it? And if it's not now, then I'd ask when. So we can definitely all go back to our business next week and change nothing, pick up where we've left off. We've had a lovely day here today. Or we can do what's necessary, take the next steps in tackling inequality. And before I sort of wish you all a safe journey home this afternoon, and thank you once again, I'll just leave you really, I suppose, with 3 pleases from myself. Please, let's get serious and take control of our own destiny. If crisis is what mobilises us, then let's define our own crisis. Today, let's declare an inequalities emergency for Gwent. Let's really start tackling inequality across our region, and if necessary with a crisis mindset, because it is a crisis. We don't need to wait for another one. It's here today. Thank you.
Okay, just to say thanks for everybody for attending. That's the end of the show, and just to remind you to use the Mentimeter and we will be measuring it and looking at it. Thanks, everybody.